Doctor, is it okay to masturbate? Doctor, is masturbation dangerous? Is it harmful? Can I hurt myself? How often is it okay to masturbate? And what's harmful and what's not? Well, this is the questions I get every single day when I speak to men just like you. And today, I would like to touch base on very sensitive topic of masturbation. Of course, masturbation is normal for both men and women. But we need to make a very clear understanding what is normal and what is abnormal, what can be harmful and what can be perfectly healthy. One of the leading causes of the erectile dysfunction is the injury that is being sustained acutely or chronically through years of time to blood vessels or vascular system of the penis. And of course, for some people, especially younger people, masturbation can play a very vital role in that. It's important to understand that a healthy man needs to ejaculate anywhere between 15 to 20 times per month. And that's to keep your prostate and your hormones healthy and balanced. Friends, if you would like to learn more about your hormones, your testosterone, how to check it, how to improve it, please look up and download my book, Perfect T. The link is right below. And if you don't have an ability to have sex that often, then you probably would masturbate. And yes, it's absolutely healthy and absolutely normal. The question is how often and the technique. Well, how often? If it's something that you do 3, 4, 5 times a day, well, guess what? It's harmful. Harmful for many reasons. Reason number one, you become less sensitive. And the less sensitive you become, the harder you go on your strokes. And the harder you go on your strokes, the more injury you cause to blood vessels of the penis. And of course, any small injury causes some scar tissue formation. And the scar tissue forms not only in the cavernous tissue, but also in the blood vessels. So you injure the cavernous tissue that needs to be filled with blood, the sponge tissue that's supposed to expand and give you a normal, healthy erection. And you're injuring the smaller blood vessels like capillaries and larger blood vessels like arteries and veins. Altogether, you're causing abundance of scar tissue formation through years, and that unfortunately starts causing limitation in the blood supply to the penis tissue. Therefore, if you've been feeling a decline in your ability to have a normal erection and you're still in your youth, 20s, 30s, or even 40s, masturbation or over-masturbation may be one of the causes. The second problem. Typically, when men masturbate, they probably watch porn. And as you probably already know, a psychological aspect often also causes erectile dysfunction. What do I mean by psychological aspect? Well, when you watch porn, you see very unrealistic scenes with very unrealistic environment. So psychologically, you reduce your sensitivity to a normal, everyday reality, and you imagine yourself to be in a completely different world. When it comes to perform in your world, guess what? It just doesn't work anymore. You live mentally in a different world. So overwatching porn, especially in the past 10-15 years, became one of the big causes for erectile dysfunction. Problem number 3, when you over-masturbate, and again, 3, 4, 5 times a day, or even every day, may be too much for you. And your body may not be able to produce enough sperm for a healthy ejaculation every time you masturbate. So you start depleting your body from the most essential thing, sperm production. And no wonder I often hear guys that say that the sperm production really decreased in the past few years, and over-masturbation may be one of those reasons. So if you don't have a regular sexual relationship 15 to 20 times a month, it's normal to masturbate maybe a couple of times a week. With that in mind, it's also important not to always stimulate your brain and excitement with porn, which is, as we said, not super realistic in life scenario, but perhaps do it with your own imagination. I hope those tips are useful. And again, most of those tips and complaints are coming from real cases that we at ReBalance see every single day. We're here also to listen to your complaints, to reason with you and explain to you what's normal, what's healthy and what's not healthy, and help you to achieve a much happier and healthier life. Guys, if you feel that you've been experiencing some erectile decline, perhaps due to masturbation, please watch my video on physical therapy for the penis. you'll learn what you can do for yourself to make some major improvements right at home.